Hi guys, welcome back to Nurse Thoughts. My name is Juna.
My name is Jeff.
So thank you guys so much for coming back to our video. Thank you so much for liking, subscribing, and also commenting in our videos. So a quick disclaimer before we go ahead in our topic. Nurse Jeff and I have been nurses for 2.5 to 3 years. He specializes in ICU, I specialize in med-surg tele. And so Nurse Thoughts is all about our rants, our expectations as nurses, and it's from our experiences. So these are all opinions. If you do disagree, let us know down in the comments so we can improve in our future videos.
So today's topic, we're going to be talking about end of life care. This can be a very controversial thing, but before we get started, this might most certainly be a sensitive topic, and it might be personal for some of us. So we'll keep that in mind, and we'll try to be very considerate with what we say as well. So first things first, what is end of life care? Basically, it is the support and medical care given to someone who is in the last stage of life when it's clear that they're nearing death from an illness or old age, or they have a terminal sickness as well. So, why is it important? Why do you think it's important?
I think it's very important to our patients or even to us when we grow older because it gives us the dignity and the autonomy to say what we want in our end of life. If we want to be aggressive in our treatments or if we want to have a peaceful and painless death.
Yeah, and reality is at the end of our lives, we are all gonna pass away. We are all gonna die. We are gonna have our last breaths and we're gonna have our last sensations, whether that's gonna be pain, that's gonna be stimulus of what we hear, what we see, and how we feel. So I think it's very important, especially when it's gonna deal with our family members and people who really matter to us. And now it sounds easy enough, right, on how to treat somebody at the last stages of life. You know, you've done everything you can, and then at the end of it, you want them to feel comfortable. You know, you give them the meds that you need. You give them all these different interventions to make sure that they feel comfortable. All right, it sounds easy enough. Now, how does it get complicated? Well, I'm gonna have to say, at first when I started nursing, I thought it would be just as easy, right? But then I started to realize that I've noticed that it's mainly family that gets in the way. It's not in all occasions, but I do see the trend where it's mainly family that aren't really fully medically knowledgeable about certain sicknesses and basically the end of life. And there's more to it than, just trying to keep someone alive. I think the thing that they don't understand the most is they think that the inevitable can be prevented, and that's what we want to talk about, because not only does it really cause pain on the patient, but as nurses too, because we advocate for the patient so much, and it's only unfortunate that our patient is in more pain than they need to be, or like they don't have to be in that kind of pain. And so that's mainly what we're gonna talk about. So
Also, I guess we don't blame anybody that's not medically inclined or medically knowledgeable, because if a patient is in the hospital, everybody assumes and expects that they're gonna get better in the hospital, which is, yes, that's what we strive for, and that's what we specialize in. But there's times where the inevitable is we can't really prevent it from happening, and so these topics are already lurking in our heads, in our minds, that I don't know how to open this to family members, because a lot of times when there's grief, the stages of grief, the first one is denial. A lot of family members are still in denial, and would still want that patient or that family member of theirs to keep on going, because they know and they think that that family member of theirs still can, when how we look at them clinically is they're very fragile already, and it outweighs the benefits of the treatments of what we do. And that's where the end of life care is coming to them and to the patient, because it's a very sensitive topic, and it's not a topic that we always want to talk about to family members, but it's a hard topic that needs to be faced by family and by patients if the patient is still coherent and conscious.
So an experience that I dealt with as a nurse at bedside was, and I've had plenty of one, but this one just really affected me the most. And it was a patient that had cancer that had already spread throughout his body. And this is a patient who knew what he wanted in life and how he wanted to face the end of his life, his final days. And this is a patient that's already gone through several chemotherapies for a number of years, and it's just gotten to the point where you just couldn't stop the cancer. And then this is a patient that was well alert oriented, like I said. He knew what he wanted, he knows what's going on, why he was in the hospital, specifically in the ICU. And then he got very sick. He was intubated. He had a breathing tube at one point to keep himself alive. He was on several antibiotics. He got really septic, lots of infections in the body. And at one point, he finally got extubated, and he was more stable enough. And, doctors have already been on board. Basically, these cancer doctors, they've been consulted, and they said there's nothing else to be done. It's already spread too much. Chemotherapy would hurt him more than anything. So mainly the what do you call it? Hospice was one of the most recommended course of action to take in his plan of care. And then when I mentioned about family earlier, and then now his family, they understood he had cancer, but because he was very much of himself still, they believed that there was still a way for him to keep going. And the most heartbreaking part was that patient, he knew he was dying, and the only thing he wanted to do was go home. That's the only thing he wanted to do, go home. And so he wanted to go home, and he was stable enough to go home, but the family did not want that. Otherwise, while he was still in the hospital, they wanted that cancer to be cured. And so I remember speaking to them one day. I was just straight up. I mentioned, look, me personally, I've been at bedside. I don't think that, the patient is not gonna last long. And if he wants to go home, he should go home now. And that's his wish. And by the end of it, he never went home. And sadly, he did pass away in the hospital, and they missed that opportunity for him to get what he wanted. So, that was probably, with that kind of scenario circumstance, that was probably my first, the main one I remember. So, and if there was only some way, it could have been different. I wish he got to go home. So that was my experience with it.
So I also had multiple experiences of talking to family members for hospice. It was also cancer, and it was in the late stages. The patient she wasn't conscious anymore. She wouldn't even turn or moan or even say yes or no. She wouldn't even open her eyes anymore. So, as a nurse, you see how they are, if they're progressing, if they have low or poor prognosis. And so they said that family members or that family member was notorious of being rude to to patients, to doctors, to anybody who goes into the room and kind of does something and like treats the mom. So I was assigned to that family for that day. And around 10 a.m., she came back because in the morning she wasn't there. So she came back and she was already very hostile. And, you know, as a nurse, you try to be really compassionate and understanding on why. And in this scenario, I completely understood why. So she was the only child, and she was going back and forth in the hospital and also picking up her kids and all of that. But she was very hostile when I first met her. And you can see how she was just having this very strong personality up front. But when I got to talk to her, just me and her, while her mom was in the room, I told her, I really understand why you're being like this. And she paused and looked at me and started crying. And so that stood out to me because I didn't know just saying those words to family can actually be like, I guess, powerful. And so she started opening up and telling me why she was like this, blah, blah, blah. And so she asked me, she told me she never asked any of the nurses or any of the doctors this question, but she was like, how do you see my mom? So I was honest enough to tell her, look, I'm not the most experienced nurse. I don't have a 20 years experience. I don't have a 5 years experience, but I do know your mom needs you. And has she told you anything that she wished for you to do before she went unconscious? And she did tell me that her mom wanted to go home while they were still in the ER because the mom was saying that she doesn't feel like she would feel safe in the hospital and she would just want to stay in their house. But she pushed through. The daughter pushed through and said, no, let's just get admitted, let's get you better and stuff like that, which throughout the weeks, she started declining. So she started to feel bad because she feels that if she would have taken her mom back home, she would have been probably better. And I told her, well, I can't really say if she would have gotten better or if she would have gotten worse. But what I do know is that if she had voiced that wish that she wanted to go back home, why don't you do it right now where she's still here, she's still conscious enough to hear us. But at the end of the day, she actually decided to go hospice, and she was thanking me, and she said that can we move this faster, and can she go home today? And we were able to do it, and she said thank you. And I told her, you don't need to feel guilty of what you did. You only did what was you thought best for her. But now it's time to give her, your mom, the chance of deciding for herself. And she had already told you so. She just kept saying thank you, and she was thankful enough to tell me that she was being hostile to other nurses because of what she was going through. And I didn't take anything personally because at the end of the day, I'm here to help out my patient, and sometimes the family members also needs help. So I think it was a really good day for me, for her, and for the unit because they had moved on and she got to go back to where she was more familiar with the patient. She got to go back to her bed, her familiar smell of the house, her dogs. The daughter said she had dogs, um, so I was really happy for the patient. And I think a couple of weeks, I think in 2 weeks or almost 2 weeks, we heard the news that she passed away in the house. So, and but the family member reached out to the director, I think, or to the charge, and said thank you for the service.
And that goes to show how much of an influence a nurse can make, especially giving that education to family, or even the way you talk to them, explain them through the process, and how much that they can really change their mind and realize what's really right for the patient, especially families. At the end of it, end of life can be talked about forever. We all have our own perspectives, and I think it's mainly of what families should really know in general, and the importance of the quality of life that you need to achieve for yourself and for their family members. So I think that'll cover up our topic for today. If, like I said, if you guys have anything more to say about this, feel free to leave comments, ask questions, subscribe and help us, and we'll catch you another time.
Bye.
Bye.